Hello, thank you for joining us today for our February Lunch and Learn during American Heart Month. Our guest speaker today is Cortney Steeples from Good Shepherd's Diabetes and Nutrition Center.
Okay, so today we have a little bit of information about how blood sugar can affect heart disease. So first we just want to take a look at inflammation and just kind of give it a definition. So we kind of understand what inflammation is. It's kind of a local physical condition in any part of the body that becomes red and swollen, hot, often painful. Usually we associate this with like injury or infection. But there's also chronic inflammation. And so this is inflammation that is prolonged, weeks, months, even up into years, and in which active inflammation, tissue injury, and healing all occur at the same time. So chronic inflammation can be system-wide, and we're kind of talking about the inflammation that you can't see. So inflammation that's in our body, which can cause damage to various cells and tissues. It can affect any part of the body. It typically leads to chronic disease and can even affect our metabolism, contributing to obesity. You can see on the screen just some different areas of the body where we can have increased risk of disease or tissue injury. So inflammation and blood sugar. So we're going to kind of talk about the connection here. First, we should look at insulin, which is a hormone made by the pancreas that helps glucose or sugar get from the blood vessels into the cells of our body. Inflammation can cause insulin resistance. So when there's too much inflammation in the body, essentially the insulin and our cells aren't talking to each other as well anymore. And so blood sugar tends to rise up in our blood vessels. If we have too much blood sugar in our bloodstream, sometimes this can lead to heart disease, diabetes, prediabetes, obesity. So what we really want to do is target this insulin resistance or inflammation to help prevent some of these conditions. So we don't want to ignore insulin resistance. Anytime there is insulin resistance, it is important to make changes to prevent complications. And one of the main ways to reduce insulin resistance or prevent insulin resistance is to focus on inflammation and sources of inflammation, or how we could prevent inflammation in the future. This is kind of a silent thing that occurs, and we don't always have symptoms. And so it is important to kind of keep an eye on maybe some risk factors, or if you have some of these conditions, to think about inflammation and insulin resistance, because we can't always feel it. So this is important because heart issues are a common complication of inflammation and insulin resistance. You don't necessarily have to have high blood sugar, but high blood sugar does make it worse. So if you don't have insulin resistance, we can prevent this in the future. And if we already have some insulin resistance, we can look at some changes to help reduce the inflammation and the resistance to improve our overall health. So reducing inflammation and insulin resistance is key to treating and preventing chronic diseases, particularly heart disease and diabetes. All right, so every bite we take is either fighting disease or feeding it. So this is a very impactful statement. So we want to fight inflammation with food, and so we'll go over a couple of tips as to how we can do that. First, let's kind of redefine what we think about as moderation, especially when it comes to eating, because all dietitians will say all things in moderation, right? And so that's kind of a vague recommendation. So we're just going to try to simplify it and make it more specific. So moderation is not eating moderate amounts of vegetables and moderate amounts of desserts. It is more like eating abundant amounts of vegetables and tiny amounts of desserts. So think of kind of each food group as having its own definition of what moderation means. And so there's a kind of a picture here that helps us to describe that a little bit better. So if you're looking at the screen on the left, maybe we're eating too many calories, 0 fruits and vegetables, and not using mindfulness very well. We can see there's kind of a lot of like junk food items. In the middle, sometimes we think of moderation as being like, okay, no sweets, only salads, only vegetables, only lean proteins, low fats. So this is a little bit over restrictive. It's not necessarily moderation either. So there on the far right, you can see that moderation can be a balance of both of the left examples. So we kind of have some, fun foods, I like to call them, sprinkled in there, but it's definitely balanced out with a little bit healthier selections. So think of moderation as kind of a balance between, some of our fruits and vegetables and lean proteins, but also still getting to enjoy maybe less healthy things in smaller amounts. Okay, so foods that feed inflammation, you can see lots of different examples here. Sugar, processed foods, fried foods, excess alcohol, really refined foods. The further away that foods get from nature, the more inflammation it can cause. So today we're specifically going to look at sugar and sugar from foods because this is probably the primary source of inflammation. So sugar is fuel for inflammation. And there's lots of sources of sugar. And I think one of the more common, kind of more obvious sources would be our sugary beverages. And this picture kind of shows little packets of sugar, and this is how much sugar is added to those beverages. So when you kind of look at it in the little baggies, you can see that it might be more than we think initially. And sugary beverages doesn't just mean soda. You can see there's some examples on here that appear to be healthy selections like orange juice or pomegranate juice, even vitamin water and sports drinks. Unfortunately, these have a lot of added sugar. Even though there might be a little bit of vitamin C or something in orange juice, it's still the sugar might outweigh that benefit. And some other examples of foods. These are kind of more of our processed foods, foods that commonly have a lot of added sugar to them. Even when we see kind of this fast food example in the lower right, a lot of French fries will come coated in a little bit of sugar in order to make them super crispy with frying. So there can be hidden sources of sugar in a lot of things that maybe we didn't initially realize. So some other examples of processed foods, again, just have a lot of added sugar. And again, these foods, the further away it gets from nature, the more risk it causes for inflammation. So kind of keeping that in mind when we're picking things out. Even though there's a steamed broccoli package on here, some of the sauces that these are coated with can have added sugar and other ingredients that don't necessarily come from nature. So we want to be a little bit cautious of these as well if we're really focusing on inflammation. Okay, so what about carbohydrates? Carbohydrate foods, when they digest, they turn into sugar. So sugar can come from healthy foods and unhealthy foods just the same. So again, we kind of circle back to this idea of all things in moderation. Carbohydrates can cause blood sugar to rise, so we want to watch the amount and the type that we're eating. So the healthiest sources of our carbohydrate foods are going to, again, be closer to nature. So we're looking at fresh fruits and vegetables, beans, whole grains, sweet potatoes, oats, and then like plain yogurt that might be unsweetened. So that way we're just getting the natural sugars that occur in these foods rather than added or excess sweeteners.
Could you give an example of whole grains?
Sure.
Just because, sometimes things are labeled whole grains, it might not necessarily be, and sometimes they have whole grains and you don't know, like, how do you know when you're in the grocery store, what is a whole grain?
Yeah, so whole grains are going to be grains that have not been stripped of the bran or the fiber coating that's been on the outside. And typically it's going to be a different color as well. So think of like brown rice as a great example of a whole grain versus white rice, where it's the same food item, it's just been stripped of its fiber coating. Oats are a great example of whole grains. You have the whole grain that's basically just been pressed, and so it's not missing any of its components. Whole wheat bread would be a great example of a whole grain. You can kind of tell because of that brown color, it's still got that bran component there. And when you're shopping for breads or crackers or items that, say they're whole grain, one of the best ways to identify it is go to the ingredients label. And one of the first two ingredients should say, word for word, whole wheat flour. if it's a wheat product. So you want those 3 words in a row, whole wheat flour in the first 1 to 2 ingredients. That way you know that there's going to be enough of that whole grain in there to give you that health benefit. The further down the list it is on the ingredient label, the less whole grain there is for you to consume. Okay, so kind of a look at foods that fight inflammation. We've kind of been talking about sugar and foods that fuel inflammation, but foods that fight inflammation can be fresh fruits and vegetables, healthy fats, herbs, and spices. And we'll look at each of these individually. So we definitely want to try to eat more vegetables. And I think I could probably say all people could probably eat more vegetables. But a good place to start is just doing 2 servings per meal. So whether it's a half to 1 cup of vegetables per meal, that's a great way to start introducing more of them into your diet. Color is key. So we want to eat a variety of colors of fruits and vegetables because the different colors do provide different vitamins, minerals, antioxidants, and phytochemicals or phytonutrients. And these phytonutrients and antioxidants are important because they do help to fight what we call free radicals. So basically just irritants that get into our body from our environment can cause inflammation and damage to our tissues. And so phytonutrients and antioxidants from fruits and vegetables really helps to suppress those free radicals. Fats are not the enemy. So the type of fat really makes a big difference. We should be eating healthy fats every day, and even some recommendations will say at least 1 serving with every meal. They give you long-lasting energy. They don't raise your blood sugar, so they don't turn into sugar after they digest, which is nice, and they have awesome anti-inflammatory properties. So this picture just shows you a couple examples of what those healthy fat sources would be. Olive oil, fatty fish, avocados, nuts, and seeds are just a few. So anti-inflammatory properties can come from herbs and spices as well. The fresh is best. They have higher concentrations of antioxidants and phytonutrients than fruits and vegetables. So we can use them pretty much as we want, especially in kind of their raw forms. This will help to enhance flavor of other foods, especially if we're trying to reduce saturated fats or sodium from our diet. These can help to replace those flavors. What about meat? I know there was a picture of the protein on the foods that cause inflammation slide. And protein is an essential nutrient for our body for building and repairing, but in excess, it can actually increase inflammation. So again, all things in moderation, right? So we do want to try to maybe introduce some plant sources of proteins as well. And a great way to start is just picking maybe 1 day a week where we choose plant-based proteins. And this picture shows a few examples. So it can come from soy or tofu, nuts and seeds. Legumes have a fair amount of protein, so those can be helpful too. So in order to prevent inflammation, right, we want to decrease, limit, or avoid consumption of sweetened beverages, too many sweets and desserts, too many processed foods, excessive refined grains or excessive carbohydrates, maybe too many processed vegetable oils, and saturated fats. On the flip side, we do want to consume more fruits and vegetables. Of course, reduce sugar from our diet as much as possible, so avoiding a lot of those added sugar products. Increase herbs and spices for flavor, introduce healthy fats every day, fewer foods made from refined flours, fewer processed foods, and high quality protein sources, whether it's coming from a plant source or an animal source. Okay, so nutrition therapy, a good shepherd. This is just kind of an overview of kind of our cost of services, and you can see it's very affordable for both employees and community members. Good Shepherd pays for up to 90% of the cost of our services. So you can see the prices there at the bottom. Cost is sometimes a concern. And then we do have a healthy lifestyle classes coming up in March. And these classes do go even more in depth to some of the topics I talked about today. So if I kind of got your imagination kind of sparked about, what more we can do about inflammation and preventing chronic disease, this class series is really helpful for that. It's 8 weekly group sessions. There's individual sessions as needed. You can see some of the topics that we go over. And March 6th, we'll begin our spring series. Okay, and then just kind of an overview of the different topics and conditions that we will help to treat in our clinic. All ages are welcome, and you can see there's a huge variety of nutrition concerns that we can help patients with. And there is our phone number if you would like more information.